So welcome everyone. My name is Helen Rosenthal. I'm the council member for the Upper West Side, the 6th district. I've been here for the last 8 years. The Upper West Side is home to many older adults who want to remain in their apartments and the community they love. My office has made it a priority to ensure that older adults are informed about the benefits and entitlements they have earned throughout their lifetimes, as well as resources that will help them age safely at home with additional support when needed. In particular, I'm going to thank her at the end, but huge shout out to Rita Gann and my staff, who is passionate on this issue and has helped so many seniors. We really, really appreciate her and thank her for that. And what she has noticed is over the past years, we've received the most questions about 2 aging in place resources. And that's what we're going to talk about tonight, which is assistance paying for home care and the ever-changing technology landscape, specifically telehealth. During the pandemic, telehealth has become increasingly important as older residents look for ways to get their health care while staying home and being safe. We have designed tonight's presentation with your questions in mind. Over the next hour, you will learn about Medicaid-funded home care, pooled income trusts, technology tools like telehealth, and more. We are so delighted and honored to have partnered with Older Adults Technology Services from AARP, the New York State ARC, which they are going to introduce themselves, Trust Services, and LiveOn NY, who will be presenting on this topic. They are all doing great work in assisting older New Yorkers and frankly, reframing the concept of aging. It's been wonderful to work with them. So especially during these unprecedented times, it's critical that older adults have strong partners in government. And again, it's been a privilege to represent your interests and concerns in the City Council. I encourage you to contact my office at 212-873-0282 or email helen@helenrosenthal.com with any questions or concerns. And again, we'll put that information in the chat. Please remember that as of January 3rd, you may contact our incoming council member, soon to be former Borough President Brewer, using the same phone number that I just gave you, and her team will be based in the same office at 563 Columbus Avenue. So again, my great thanks to LiveOn NY, New York State ARC Trust Services, OATS from AARP, and my constituent liaison, Rita Gann, who worked so hard to make today's event possible. And I would also like to give a quick shout out to Project Find for holding an in-person simulcast party of tonight's presentation at one of their locations, the Annex, which was formerly Hargrave Senior Center. So now I'm very pleased to introduce Marco I'm going to mess up your name and you'll pronounce it better. So Marco Di Girolamo of Senior Planet and Older Adults Technology Services and the New York State Program Manager. Take it away, Marco.
Thank you, Councilmember Rosenthal. My name is Marco Di Girolamo. As Councilmember mentioned, I am the New York State Program Manager for Older Adults Technology Services, Senior Planet from AARP. I just have a few quick things I wanted to bring to everyone's attention. First is that this is a recorded event. So if you do not feel comfortable being on camera, you are more than welcome to turn off your camera, and you would have seen something pop up as you were joining the event. In addition to that, if you are asking any questions in the chat, please be mindful that your name is showing up. So if there is anything private or confidential that you have in relation to any of the topics being discussed tonight, please be mindful that your name will be showing up in the chat. So we would recommend that you don't ask anything too personal. And
Marco, can I ask you,
Yeah.
can you explain to people, or perhaps you were just about to do this now, about the closed caption that people can access?
Sure, no problem. Thank you. So there, for those of you who would like to see closed captioning, if you click on, if you are on a computer, there is a More tab, and if you click on More, it'll give you a list of different options, and one of them is live transcript. And if you click on live transcript, you will see a live transcription of everything that is being spoken tonight. In addition to that, I wanted to also add that at the end of tonight's event, every one of you, you're here because you registered. We have your email address. We will be sending you a recording of this event. And in addition, if there are any questions that we are unable to get to, there are many of you tonight, we will be, to the best of our ability, answering all of those questions in a follow-up email that we will be sending out with the recording after the conclusion of tonight's event. So once again, thank you all very much. And thank you, Council Member Rosenthal, for hosting this amazing event. And I will now pass it over to Kim Lerner from LiveOn New York.
Good evening, everybody. Before I begin, I want to deeply thank Councilmember Rosenthal for sponsoring tonight's event and for being a tireless advocate for New Yorkers, especially older adults. I know I speak for many New Yorkers and specifically for LiveOn New York when I say we're really going to miss you. A lot, tremendously. I also want to thank her amazing staff, Rita, and her colleagues for the wonderful partnership that we've had for the last couple of years. We really appreciate it, all the work that you've done with us. So again, my name is Kim Lerner, and I'm the director of LiveOn New York's Benefits Outreach Program. And I thank you all for joining us. I'm going to be talking about Medicaid and how it can assist us in our quest to age and remain in our homes. So first, I'm going to share my presentation, but I know many people are not familiar with LiveOn New York, so I'm just going to take a brief moment to discuss and tell you about the work.
Kim, for some reason, sorry to jump in, we're hearing a lot of static, so it's hard to hear you. Is it possible maybe your hair is touching a microphone, or a cat is walking on the screen, which does happen sometimes?
No.
But if you could, or maybe your hands are touching something, so just be mindful of that. Thank you.
Is better now?
Yes.
Okay. Sorry about that. So I'm going to share my screen. Okay, I hope everybody can see that. Yes? Okay. So a little bit about LiveOn New York. LiveOn New York is a membership advocacy organization of over 100 community-based nonprofits that provide core services which allow New Yorkers to thrive in their communities as they age. And we do this through three main ways. Whoops. We advocate for just policies on behalf of older adults. We advocate, so that means advocating for affordable housing, community services for older adults like senior centers or NORCs and case management agencies. And we also advocate for enhanced or expanded access to benefits programs. The second area we focus on is training and education for professionals who work with older adults. And then finally is our benefits outreach program, which offers screenings of a whole host of benefits programs, and we provide assistance in helping people apply for those benefits. So I'm going to focus now on our main reason for being here, which is discussing aging in place. So according to a poll conducted by AARP, 77% of people who are 50 and older want to age and remain in their home. And there's good reason for this. Many older adults feel an emotional attachment to their home and community. But not only is there a reason for that people want to remain in their homes, but there are benefits to remaining and aging in place. And the first one is it enhances the quality of life and self-esteem. Secondly, it promotes freedom and independence. And thirdly, it strengthens connections to family, friends, and community. But the benefits to aging in place aren't only beneficial to individuals. Aging in place also benefits the community, because we all benefit from the vitality, experience, and wisdom that older adults share with all of us. So even though the goal, of course, our final goal is to remain at home and age in place, there are certainly challenges and barriers that may come up. For example, you may need to modify your home so that it is safer for you to remain in home. So you might need to add bars in your bathroom or whatever it may be. You may need help with safety issues. The second barrier could be finances. So since many people are living on a limited income or a fixed income, they could use benefits programs to enhance and augment their income. So benefits like SCREE, SNAP, and Medicaid are very helpful to addressing that challenge. And finally, as we age, certain tasks that we may have been doing all of our life may become difficult. So it may be the time at some point we need home care to help us around the house. For example, doing household chores, cooking, cleaning, and sometimes bathing. So as we all know, home care can be very expensive. And if you are not able to pay out of pocket, or if you don't have long-term care insurance, Medicaid is really the only way to be able to access home care. So I'm going to talk a little bit about Medicaid, and I just want to preface this by saying this is not the full story of Medicaid that I'm going to talk to you about. It's going to be just the basics. I'm going to explain to you what the eligibility criteria is, how to access Medicaid, and how it can help you access home care. So in New York State, there are two ways that you can access Medicaid services. The first one is through the Department of Health, or also known as the Marketplace, and that is for people, pregnant women, children who are under 19, parents and caretakers of children who are under 19, and single or childless couples who are age 19 through 64, who are not entitled to or already enrolled in Medicare. So that population would be accessing Medicaid and applying for Medicaid through the Department of Health. The next population is 65 and older, people who are disabled or certified blind, and they would access Medicaid through New York City's Human Resources Administration. And I'm going to be focusing on this population for most of my talk. But there are three different types of Medicaid coverage that you can get when you apply for Medicaid. So I'm going to go through all three of them. The first one is called Community Medicaid, and that's also known as straight Medicaid. And that is your basic Medicaid coverage. So it covers doctor's services, inpatient and outpatient hospital services, laboratory tests and x-rays, dental services, vision, and prescriptions. So that is the basic coverage. Then there is institutional Medicaid, also you might know it as nursing home Medicaid, and that is for people who need long-term care in nursing homes or health-related facilities, intermediate care facilities, or residential treatment facilities. And finally is the community-based Medicaid with long-term coverage, and that is the most relevant for our discussion today, because that is the coverage that will enable you to have home care, to access adult day health care programs, assisted living programs, hospice in the community and residence programs, personal emergency response services, and private duty nurses. So if you need home care, this is the type of Medicaid you would apply for. To apply for Medicaid, you need to complete an application and also provide supporting documentation, and that includes IDs for each person in the household who's applying for Medicaid, proof of their immigration status if they're not a citizen, proof of their New York City residence, proof of their monthly income, and proof of their resources. So that includes bank statements, life insurance policies, pre-burial plans, and retirement funds. Now, once you submit the application, it can take up to 45 days for the Human Resources Administration to make a determination. So just a little bit about Medicaid eligibility. Medicaid eligibility is based on the number of people in the household who are applying for Medicaid, their monthly income, and there is also a resource test that they must meet. So for one person, the maximum income is $904 a month, and the resource limit is $15,900. For two people, it's $1,320, and the resource test that they must meet is $23,400. Now that resource level does not include your house, that's your apartment or your house, or a car. So contrary to what many people think, you can receive Medicaid and have a home and or a car. Now, in looking at those numbers, I'm sure many people are thinking there's no way you would be eligible for Medicaid because the income level is so low. But there is a program that you can be approved for that would enable you to access Medicaid, and that is called the Medicaid Spend Down Program. Also, you may have heard it talked about using the phrase surplus or excess income program. So this is, again, specifically for individuals who are otherwise eligible for Medicaid. In other words, they meet the resource test, but their income, their household income, is over the Medicaid income level. So when we talk about the Medicaid spend down, the spend down refers to the amount of monthly income that the household exceeds the maximum monthly Medicaid income level. So in other words, your spend down will be the difference between your monthly income and the Medicaid eligibility limit. So you can kind of think of it as a deductible. So an amount like a healthcare deductible, an amount that you must meet before you become eligible for coverage. So I'm just going to give you an example, just so maybe it'll make it a little clearer. So if your monthly income, for example, is $1,204 a month, and you know the Medicaid limit is $904 a month, that means that your spend down, the difference between the two, would be $300. So you have to meet that $300 spend down each month in order to receive Medicaid coverage. There are three ways that you can meet the spend down. The first one is through the medical bill system, and that is where you can use paid or unpaid medical bills to meet that spend down. So you would fax or mail proof of those expenses to the Human Resources Administration in the amount of the spend down, and then you would receive coverage, Medicaid coverage for that month. The second option is the pay-in program, and that just means you would pay the amount of that spend down to the Human Resources Administration. And the final option is the pooled income trust, is to create a pooled income trust. And Sarah is going to discuss that with you in a couple minutes. Now, once you are approved for Medicaid, the next step, if you want to access home care, is to be assessed, is to go through an assessment or an evaluation. So in this case, in order to access home care, you need to need home care for at least 120 days. So the first step is to request an assessment through the Conflict-Free Evaluation and Enrollment Center, also known as SFEEC. And what they will do is they will do either an in-home assessment or a virtual assessment to see if you are eligible for home care. If you are deemed eligible for home care, the next step is for you to enroll in a managed care program. And once that is done, somebody from the agency, the managed care agency, will come into your home or virtually complete another assessment, which will determine the level of care that you need and the number of hours that you're eligible for. So as you can see, the Medicaid process can be rather lengthy. It can take at least up to 2 months or so. So for people who are in urgent need of home care, there is an expedited process that's in place. For example, if you are being discharged from a hospital or your health is deteriorating while you're living in the home, you may be eligible for this process. And this process shortens the wait time for Medicaid to 7 days. So that is by policy. The Human Resources Administration must make a decision within 7 days. And then they have 12 days for a home care to be authorized. So as you can see, it's a much shortened version of the process, but it's very helpful for people who are in urgent need of this assistance. So I know this was brief, and I hope this was helpful. If you have additional questions or you want to be screened for all of the benefits, SNAP, SCREE, Medicaid, all of the benefits that may be available to you, please feel free to reach out to us. We will walk you through the process of applying and support you throughout the process. So you can reach us at 212-398-5045 or benefits@liveon-ny.org. So thank you all for listening. I'm going to see if there are any questions in the chat. I don't think I see any questions in the chat. Okay. So Sarah, I will hand it over to you.
Wonderful. Thank you, Kim. And thank you so much, Council Member Rosenthal, for inviting us and all the presenters for sharing this wonderful content this evening with everyone. I'm going to take a moment to just share my screen really quickly and get my slides up for you. I'm sorry, I just need to switch the view. Are you guys able to see it, or is it showing up on my other screen? We did test this.
Sarah, I'm seeing it.
We can
Okay.
see it, Sarah.
It's up.
All right, great. And you guys can hear me okay? All right.
Yes, we can.
Okay, fantastic. So my name is Sarah. I'm the Director of Outreach at NYSARC Trust Services, and we are a not-for-profit organization that has been administering special needs trusts since 1972. We were the very first program in New York State and also the United States to administer pooled trusts to help people qualify financially for Medicaid and other means-tested benefits. As Kim mentioned, this is a program that can help someone qualify financially for community-based Medicaid services like home care in situations where they have too much income or money in their name to qualify for those benefits, but not enough money available to cover the high costs of private paying or paying out of pocket for those home care services. Kim's already covered, community Medicaid gives people a lot of benefits beyond just home care. Home care is obviously one of the key reasons, but there are many other ways that can help offset other costs for seniors and people in New York State. Medicaid spend down program is when someone has too much income to qualify. As Kim covered, their excess income or surplus income needs to be spent down on a monthly basis. And this is going to be different, as she mentioned, whether or not you're a single individual or if you are married. And there are different budgeting options that are available to different families based on their situation. When there's a healthy spouse that is in need of service, or a spouse that's in need of services, and then another spouse that is healthy and may not be needing those services, there are additional budgeting options as well. So it's always good to be asking about all of those options when considering Medicaid benefits. When someone has a spend down, as Kim mentioned, they have 3 ways to meet that spend down requirement. Give the money to Medicaid, use it towards the cost of medical bills, and send those receipts to Medicaid until you've met your spend down on a monthly basis. Or in New York State, we're very fortunate, they allow people with disabilities and qualifying adults who have a need for home care or a disabling chronic condition to put that excess income into what's called a pooled income trust. By depositing that money into a pooled trust, they're able to use that money for the things that they need it for, things that are going to allow them to afford to live in their home and stay in the community. By giving that money to Medicaid each month, or using it towards medical bills, it can be difficult for someone to afford their rent, utility bills, food expenses. So using a pooled trust allows you to kind of get the best of both worlds, getting access to those Medicaid services and getting to continue to utilize your income, your hard-earned income, for your monthly living expenses. This is going to enable you to stay in your home for as long as possible. Pooled trusts are a special type of irrevocable supplemental needs trust, which is designed to help people with disabilities protect money that's in their name so that they can financially be eligible for means-tested government benefits like community Medicaid. In order to participate in a pooled trust, you do need to have a qualifying disability, and typically the need for home care services, the types of things that go along with getting older are going to qualify someone to use a pooled trust to meet their spend down requirement. This program is allowable under federal law and New York State to help people qualify for Medicaid services. And the unique part about a pooled trust is that it is run by a not-for-profit organization like NYSARC, and we then manage the funds on behalf of the individual who's in need of Medicaid services, called our trust beneficiary. The goal being to allow them to get that money out of their name so that it's not counting against them for Medicaid eligibility purposes, but that they can still use it for paying for their monthly expenses and making purchases that will improve their quality of life and their ability to age in the community. It's very important also to keep in mind that a pooled trust is irrevocable in order to protect a person's eligibility for services. That means once the money goes into the trust, it must be spent down on that individual. Those funds cannot necessarily be returned to that person. That's to protect their eligibility for benefits. If you could set this up, put your money into it, and then just ask for it back anytime and get it out of there, it would not actually help you qualify for benefits. That would be considered available to you. So that's important for people to understand. But you can opt out of using the trust if you decide you no longer need Medicaid or you no longer want to utilize a pooled trust. You can simply contact the trust, spend down any funds that are in the account during your lifetime on eligible expenses, and you can pay your spend down to Medicaid, or perhaps maybe you no longer need Medicaid services. Because this is a first party trust, meaning that it is a person's own money going into the trust in order to protect their eligibility for benefits. There is a payback provision to Medicaid. And so the trust account will close upon the death of the trust beneficiary. And any funds that remain in that account would be retained by the pooled trust to support other people with disabilities that are served by their philanthropic mission. Otherwise, it would go to repay Medicaid for the services that were provided to that individual during their lifetime. Now, there should not be a large amount of money in someone's trust at their death. We should be spending this money each month to pay for their bills, and there should not be a large balance in the account. That's why it's so important to stay in touch with the trust and be submitting requests regularly to be using that money. The goal is to spend down all of the funds and use that money to help support your ability to live in the community.
Sarah, I don't mean to interrupt you. There are a few people in the chat saying that you're frozen on slide 2 and that your slides are not advancing.
Are you seeing them?
No, it's not advancing.
Okay, give me a second. How about now?
Better, right? Now it's working.
Okay. So this is the last slide I was just covering, overview of pooled trusts, how they work, what is the legal ability to use a pooled trust, and how you can be eligible to use one. And the purpose of this program is to help someone qualify for these benefits, but also maintain their eligibility for services on a month-to-month basis, allowing them to qualify for benefits that will help pay for medical expenses that are not covered by Medicare, mainly home care being the biggest thing people are looking for, giving them that ability to get access to services in the comfort of their own home, get assistance with those activities of daily living, like cooking, cleaning, things that they may not be able to do on their own anymore, and gives people really an alternative to going into a nursing home, or even an avenue to return home from a nursing home in situations when someone might be in for a short-term rehabilitation or has been there and is looking to get back into the community. This is also something that benefits not only the individual, but their caregivers, individuals in their family who may be providing unpaid care. Getting benefits in place can help get services there so that they have some respite. Those caregivers can feel peace of mind knowing that their loved one is being cared for when they're not able to be with them. And it can even help relieve some financial constraints that they may be helping to pay for some of these services as well. So getting benefits can help with all of those, and pooled trust can help someone do that. Now, using a pooled trust, there are some costs to join the account, and there are monthly costs to maintain that account. So most trusts are going to have a one-time enrollment fee, which is the cost to join the trust. That's going to be charged one time when they join, and those are going to vary by trust. There are a number of pooled trusts in New York State. If you Google list of pooled trusts in New York, there's going to be a list you can look through, and most pooled trusts have their fee schedules publicly available on their website for you to review. Initial costs are usually a couple $100s. In our program, it's $200 to join. I've seen it as high as $350. And then the monthly fees are going to be based on the amount that you're putting into the account each month. So going back to Kim's example, with the $1,204 a month income minus the $904, there was a $300 spend down. So that $300 that they're putting into the trust is what the pooled trust will base their fee on. Our fee is a sliding scale, and it's a fixed flat fee based on where you fall within that range. Other trusts might charge a percentage of the spend down. And in some circumstances, a pooled trust might charge based on how many requests you're making on a monthly basis. Beyond that, look out for other types of annual expenses that the trust may charge. Every trust provides different services. And like I said, look for things like limits on disbursement requests and additional charges maybe for those types of things. But when you compare the costs of using a pooled trust, it is going to be significantly less than the cost of turning over that entire $300 to Medicaid. So there is certainly some expenses involved, but it is a great way to get access to these benefits and get to continue to utilize as much of your monthly income as you can. So Kim kind of went through this process, and I know we don't have a lot of time. So I'm going to just skip through this pretty quickly, but when someone is ready to move forward with a Medicaid application, that application can take much longer than it would to establish a pooled trust. A pooled trust can be opened in about 1 week's time, even shorter window if someone really needed to get started. In the order of the steps will vary for this process. You know, the first is looking at your resources. Are you above that resource limit? There are ways you can get your resources down below those limits. Those resources might be things like savings accounts, checking accounts, money in stocks and bonds, things like that. Getting that Medicaid application started. If you're not already receiving Social Security disability benefits, you may need to do a determination of disability with HRA and the Department of Health to formally deem you disabled in order to use a pooled trust. And once you do apply for a pooled trust, it is really important that you submit your pooled trust documents to Medicaid, informing them that you're using a pooled trust to meet your spend down. If you do not inform Medicaid or your managed long-term care plan, they may not know that you're paying your spend down to a pooled trust. And you might get letters from your MLTC asking you to pay that spend down. Unfortunately, we've seen that happen where someone pays their spend down twice because they think they have to also send it to the MLTC. So it's very important that when you do choose to use a trust that you are submitting those executed documents once you apply to the appropriate agencies to inform them of your participation. Then you'll be able to start putting your deposits into the trust. Medicaid will do that assessment and figure out what services you'll have available. And the money in your pooled trust account can be used to pay for items and services that your benefits do not provide. So here's just a quick example to help illustrate this for you guys, where we have someone named Hilda who's 80 years old and single. She's living in an apartment in Queens. She's got diabetes, hypertension, and some mobility issues, where she would really benefit from getting a home health aide to come in, help her with things like cooking, cleaning, dressing, and bathing. Her income is above the limits to qualify for Medicaid, but she doesn't have a lot of money in her savings account. Home care services can cost as much as $10,000 to $12,000, in some cases $15,000 a month. So $5,000 isn't going to get her very far. Medicaid will calculate her spend down. This is a very simplified version of this calculation by taking her total income, subtracting out the amount that she is allowed to have in income and qualify for Medicaid, which is that $904, where she has an excess income of $760. She wants to use a pooled trust to meet that spend down, and the monthly fee for the pooled trust will be $60 a month, leaving her with approximately $700 each month that's available in her pooled trust to help her pay her monthly living expenses. So she's going to have about $700 available each month. What are some of the bills that she might use that money for? Rent is usually the first thing we look at. It's something we can pay automatically each month, which is a way to make it easy to use the trust and automate this process. So it will allow you to kind of limit the amount of documentation that you need to keep track of and send to the trust. And you want to look for 1 or 2 larger bills that are going to add up to about what you're going to have available each month, so that you're sending the same bills each month and getting into a flow where like these are the bills the trust is going to pay. And that allows you to be more flexible with the money, the $904 of your income that you get to keep each month. We'll usually recommend 1 or 2 larger bills, as few bills as possible to make the process easy. And I usually recommend also picking a bill that's always easy to get another copy of, because we do need to see the documentation in order to pay for these requests. And so if you pick an electric bill, and you can always go and get another copy of the electric bill if you need it. So as far as using the pooled trust, each month you will need to make your spend down deposit into the trust. And you can do that by sending it electronically from your bank account or by mailing a check. Disbursements out of the trust must be for the primary benefit of the trust beneficiary. So that's the person who's receiving Medicaid services. And we're going to typically be paying for things like their living expenses, rent, electric bill, cable, cell phone, food expenses, over-the-counter items, things that they need throughout the month to help them live safely and comfortably in the community. All requests must be substantiated with some form of documentation. If it's a rent payment and you want to do it automatically, you send us the lease, you tell us what day of the month we pay it, and every month we pay that automatically. You don't need to send a request every month because that's an automatic payment option. An electric bill can fluctuate from month to month. So each month you'll make a request by filling out a form, authorizing us to pay a bill, and submitting a copy of that bill for us to pay that to a third party. We pay the business or the landlord directly. We never give money to the beneficiary or their spouse. That undoes the protection we've created by giving that money back to them. So we pay third parties like a business, or we can reimburse someone who purchased something on behalf of our beneficiary. Requests can be submitted by fax, email, and mail. Some also have online portals where you can upload requests that way as well. As I mentioned, automatic payments are for fixed recurring expenses that will not change from month to month. And so there are some examples here of different automatic payments that we have in our trust. And I would encourage you guys again to ask these questions when you're exploring and talking to pool trusts about using their services. There's also a nice video on this slide, which I'm not going to play right now, but it's a really great example and shows you how this one beneficiary used the trust to be able to get home care and stay in her apartment. Here are some examples of the most common disbursement requests. You're either submitting a bill or receipt asking us to pay for an expense that's in the beneficiary's name, like rent, mortgage, utility bill, perhaps it's a loan payment, maybe they have an insurance premium, everything to newspapers, subscriptions, Netflix, and Amazon purchases. You can also submit receipts for when someone has purchased something for you and they're looking to be reimbursed for that. We can reimburse anyone who is not the beneficiary themselves, their spouse, or legal guardian. And then another really great way to use the trust is to put expenses and purchases on a credit card. That gives you the freedom of being able to go out and buy the things you need throughout the month and submit the credit card bill with the itemized receipts to the trust to have the trust pay your credit card bill each month. You can't buy things using your debit card and ask the trust to reimburse you. We wouldn't be able to do that, but you can buy things on a credit card and we can pay your credit card company for that balance for any eligible expenses. And then in some cases, you might be looking for a larger purchase. And so you might want to get a quote or an invoice and send that to the trust ahead of time. We'll review that and essentially approve that so you know you're okay to move forward with that expense. As far as monitoring and reporting on the trust, as I mentioned, you must send your pool trust documents to Medicaid. That is the last piece of this process. It's so important to make sure that Medicaid is aware that you're paying your spend down. They might ask for something like a verification that you've met your first deposit. That's something the pool trust can help facilitate. You're also going to want to know, how are you going to be able to communicate with the pool trust? How do you track the activity in your account? At NYSARC, we have a team of customer service representatives that are available 8:30 to 5. You can always pick up the phone and call us. We're available. We're going to answer that phone and we're going to be able to answer the questions and help guide you through the process. We have an automated phone line where people can call and listen to a recording of their recent transactions, and they can also access information online. We send monthly bank statements that help keep you up to date on the balance and activity in your account. And we can provide activity reports and verifications of your deposits to Medicaid and other agencies when those are requested. There are going to be different documentation requirements for different pool trusts. It's really important that we have that documentation. Medicaid may ask us for receipts at any point, and if we don't have the proof, it could put the person's benefits at risk. So it's always good to ask the pool trust about their documentation requirements and how they keep record of those documents. This is something that is very important to ensure that we can maintain your eligibility for benefits and report to Medicaid when needed on those expenses. It also helps us ensure that we are using the funds for our beneficiary. That's how we're able to make sure that these are expenses that are being paid for our beneficiary, and we monitor activity to see if, for example, someone's sending $4,000 a month in grocery expenses for one person, we may, see that that might not all be for our beneficiary. So that documentation is very important to ensure that the funds are being used for the individuals we serve to improve their quality of life. And with that, I'm going to open it up if we have a little bit of time for questions, or we can save that to the end.
We have two questions that came up during the presentation. The first is, is your rent considered in the pool trust? Like if your rent is over $2,000?
So I don't know exactly what they mean by is your rent considered. When Medicaid does their budgeting to figure out what your spend down is going to be, they're not going to deduct out the cost of your living expenses. And that's the challenge, right? Is that if you are having to pay this spend down, you're not going to be able to afford your rent, and they're not going to take that into consideration, right? So it doesn't really matter, I guess, in that regard. And then the other thought I have in relation to that question is, the trust is only going to be able to pay for rent up to the amount of what we have available in the account. This is a checking account, is similar to a checking account in that regard, where you have the money that is your money minus any costs of the trust is available to you. And once that money has, been spent for the month, we have to wait until you make your next deposit until there's other things that we can pay. So if the cost of your rent exceeds what you have available in the trust, we can either pay a portion of your rent and you can pay the rest to your landlord directly, or you can deposit a little bit more money just to make it up into the trust so that you can pay the full amount of your rent. And that really is a very unique situation, but different for everybody what they choose to do.
Great. And then there was a question, does the pool trust have a limit on assets?
No, so there's no limit on how much money you can have in a pooled trust, if that's what they're asking. You do have to have your assets below those limits that Medicaid requires in order to qualify for benefits and use a pooled trust. So the asset limit comes from Medicaid. There is no limit on how much you can put into a pooled trust to protect that money. But it's important to keep in mind that you're going to be able to use this money throughout your lifetime. And then upon your death, that trust account closes and any money that's in that account will be retained by the trust. So you really only want to put in what you're required to put in and no more than that, to make sure that you're using all of that money during your lifetime. And there may be other ways you can protect assets that might be better option to you than putting that money into a trust.
Great. Just for time purposes, we'll hold off on the other questions that were asked until the end if there is more time.
Great.
So we'll pass it over to Sherilyn Freeman from Senior Planet Older Adult Technology Services.
Hi, everyone. My name is Sherilyn, and I am the training lead here at Senior Planet OATS, and I am going to share my screen with you. Let me move it over a little bit. Can everyone see that?
Yes.
Thank you. Senior Planet, and we just joined AARP earlier this year. So here's an introduction for those of you who have never heard of us. We are called Senior Planet. Our motto is aging with attitude. So it is how we work with seniors and prepare them for the next phase of whatever it is that they want to do. The Senior Planet training model is designed with and for older adults. We teach mainstream devices and applications. So if you have an iPad, an iPhone, a smart TV, any of if you do Facebook, Instagram, all of that kind of things are the types of devices and applications that we do our training on. And the emphasis is also on partnerships, not only a partnership with other organizations like maybe Verizon, et cetera, but also partnership with the seniors that we're working with. So what is OATS? OATS is Older Adults Technology Services from AARP. It's a social impact organization. And the mission is to harness technology to change the way we age. The creator of Senior Planet Aging Connected is also an initiative to bring 1 million Americans online by June 2022. What happened was last year after COVID, we realized that there were so many seniors out there who really wanted to interact with each other. And so we changed our model from a in-person program to virtual program. And we were able to open it up to many seniors outside of New York. And in addition to the ones who live here. We work with nonprofits, corporate partners, government organizations to bring innovation solutions to the intersection of aging and technology. So seniorplanet.org is our website. It has about 1 million visitors each year. We do tech, fitness and wellness. We have open discussion, book club, and much more. One of our popular classes is with Cass, and it's the exercise classes, and it is filled with many seniors who love exercising on a daily basis. We also have original content geared towards a 60+ reader.
Oh, I just texted you wondering.
That
Mouse?
Senior Planet locations include 6 geographies across the country. We're in New York, we're in North Country, upstate New York, we're in San Antonio, Texas, Montgomery County, Maryland, Colorado, and Palo Alto, California. So we're in many different locations, not everywhere, but many places. So some of our impact areas include health, social, creative, financial, advocacy, to name a few. And these are some of the things that we really work with. In the health and wellness impact area, our daily exercise programs, like I said, we have a Monday through Friday, 5 to 10 week fitness courses, health and wellness lectures and workshops. And they can range for many things like online drug resources, online health resources. We look at MyChart, we look at mindfulness apps, we look at the Internet of Things and healthcare. And we also look at telemedicine, which is probably our most popular lecture since we started doing online classes. So telemedicine, it's a lecture. It provides an overview of telemedicine options and focuses on virtual medical appointments. So we teach you what to bring with you when you have this type of appointment, the different questions you should be asking to your provider, whether it's your doctor or it's insurance, depending on which one you're using. We also showing the next telemedicine lecture, which will be on December 16th at 1 o'clock. 1 to 2:15 p.m. and you should register for that class because we do try to limit the amount of people who can come so that we can actually give you the information in a comprehensive way. So it's a very good class. If you get an opportunity to take it, please do. So our virtual program impact since March of 2020, and this is around the time when the COVID started, we've held about 4,130 virtual programs. We've adapted a lot of our in-person courses to be online, and we've had about 212,304 engagements. That's a lot of people. I've taught many of those classes myself. About 44% of the virtual program participants had never attended a Senior Planet program before. So what did we do? We actually introduced Zoom to our users, and then went from there, they actually were able to actually take classes. We usually get a 93 NPS across all of our programs. And after taking some of our classes, people said that, 86% felt that the world around them is now more connected. About 78% are confident in connecting with friends and family. So we show them some tricks that they can actually show others. 82% felt better equipped to find resources online, and 81% felt less alone. So some of the takeaways and resources, please check us out on seniorplanet.org. We put something up and you can see a couple of days in advance what classes are coming. But one of the best ways to interact with us is actually to sign up for our newsletter. That's where you can get in advance any classes that are upcoming that you may be of interest to you. We also have online resources. We have handouts that are part of the courses that you hopefully will be taking. We have articles and senior planner stories. We have Zoom resources. I really like our tech tip videos because it really breaks down all the things that you need to do regardless of what you're trying to do, whether it's signing up for an Apple ID or just looking at Zoom itself, because there are different parts of Zoom that are kind of cool and people don't know are there. And it also gives you COVID resources. We also have a hotline. Our hotline is from Monday through Friday, 9 to 5, 888-713-3495. And our trainers are the ones who are manning that line. So they are the people who are teaching, but they're also the people who are talking to you on the phone and can assist you with whatever it is that you might need. And oh, that was it.
I want you to tell you.
So I'm going to check in the chat to see if there are any questions.
I think somebody had their hand raised.
Yes, I did.
Okay.
I have called that phone number. Nobody ever answers that phone number. I was online and I looked at all the phone numbers. Nobody answers that phone.
Ma'am, if there's a lot of people calling, we can't get to there's only one person on the line. Ma'am, at any given time, if you leave a message, we can return your call.
In other words, the call goes to some voicemail. There's never a person who is manning the phone.
No.
I've tried it several times, I know.
Okay, we'll check it out, okay?
I just think you should, I'm sure you know it. I'm sure you know it. I'm not making it up. I was trying to find out something and I kept dialing all the numbers.
I have a question.
All right, thank you so much for that. We'll definitely take a look, okay?
Good idea.
I'm just going to say something. At the end of the presentation, we are going to give contact information for everyone that presented. So if anybody would like to reach out to any of our presenters with any questions or concerns, you can definitely do so. And so we're going to be sending out an email with that information, summarizing what we were talking about with Q&A questions we were not able to address this evening, along with contact information. So everyone will have that right after the presentation when we recap all of this.
Hi, Beverly, I see your hands raised.
Yes. I just wanted to say to the colleague who has had difficulty reaching the hotline number, I've taken many classes with Senior Planet, and I have had occasion to call the hotline, and I fortunately was more successful. I did reach someone and they were very helpful. So I don't know what the problem is, but I just wanted to say there are many of us who have used it and have been very pleased by the classes and the support that's been offered. So that's just my input. So I wanted to make sure to say that.
Thank you, Beverly.
Mm-hmm.
Do we have time for any more?
I challenge anybody to try that number during the day several times and see what happens.
Do we have time for any more questions? Ms. Viola?
Yes, good afternoon. And what is your name?
My name is Sherlyn.
Sherlyn?
Yes.
Well, I can agree with the young lady that was saying that she don't get no answers. But I'm saying normally at the beginning of the classes, when you'll start servicing the seniors, they were right on time. But I'd say in the last week or two, I've been having that same problem. But other than that, like I said, all the workers, they bent over backwards trying to solve your problem.
Thank you, Viola.
Alrighty, are there any other questions for Senior Planet, Older Adult Technology Services?
Or live on.
Or LiveOn or NYSARC?
Marco, I did see one question in the chat, which I would love to respond to if
Sure
we
thing.
have time. So someone had asked about pocket money. How do you have pocket money to be able to go out and make purchases throughout the month? It's really important to keep in mind that not all of your income is going into a pool trust. It is only the amount of your income that exceeds the Medicaid limits that you're putting into a pool trust. So your pocket money is your money you get to keep each month. Your pocket money is the $904 of your income that stays in your bank account before you pay your spend down. And it's also any other money you might have in your name that's below that $15,900 resource limit. So you might have money in a savings account up to $15,900. So that's where your pocket money comes from. And like I said, you can use a credit card to be able to go out and make purchases throughout the month and submit those receipts after the fact to have the trust pay for those expenses as well, if you have additional expenses above and beyond what you have available to you.
Sarah, somebody in the chat is asking, how are personal items reimbursed for things like hair appointments, eating out, restaurants, etc.?
Absolutely. That's a great question. So that is usually going to be easiest to pay for on a credit card and submit their credit card bill with the itemized receipts for whether it's the hair appointment or the restaurant. We are only going to be able to pay for the individual, the beneficiary's meal if they're going out to eat, for example. But if they have to be accompanied by a home health aide, for example, and that home health aide is going to take them out to lunch, if we can get a doctor's note, we can sometimes pay for the individual's lunch also who is accompanying that person when it is needed. Another way would be to have someone pay for your hair appointment, like your daughter or your son or grandson, and we would reimburse that person for paying for your hair appointment. We understand sometimes hair appointments, nail appointments, those are things that sometimes they really only take cash. They might not accept a credit card. And so that could be something where someone buys it for you, or if that hair salon would be willing to accept a check from us, we can try and make a direct payment. So we usually will work with the person depending on where they're getting that service from and figure out the best way to pay for that, most efficient way to pay for that expense.
Thanks, Sarah. I see two people with raised hands. Betty Frumkin, did you want to ask a question?
Yeah, concerning the pool trust, if somebody, and paying rent, if somebody's living with a spouse, can they take the full amount of the rent or the house expense, or it's only half?
Yeah, great question. So when you live with your spouse, we're going to pay your full rent. We're not going to prorate your rent. When you're living together, when your spend down is being calculated, that's all being calculated based on both of your incomes. So both of your incomes are going to be contributing towards the money that's going into the trust. So we do pay for the full amount of that rent if you're living with your spouse. If you are living with your adult daughter and her children, that would be a situation where we would look at prorating those expenses. We might pay your portion of the utility bills. Some families will draft up a lease between the daughter and the mother, and mom will pay the daughter rent each month. That's a way we can automate, payments from the trust to cover the cost of their living expenses. And again, it would be their portion. In some cases, also, people might just live with a friend. You might be sharing an apartment with a friend. In those cases, we would look at paying your portion of those expenses.
Can I please ask a quick question? I don't have my image up to wave my hands. This is for Sarah.
Sure, go right ahead.
Okay, I've put it on the chat, but I haven't had an answer. I have an involved problem where I have to pay a high penalty. And rather than talk about it now online, which may take some time, can I please call you directly tomorrow because you seem so well informed?
Yeah, so you can contact NYSARC. Our contact information is in the chat, and I think they're going
to— No, I have the number. I have the number, but could you tell me a good time to call where I could speak with you directly?
Certainly. So really tomorrow, let me just double check my schedule.
Friday.
So anytime after 11:30, you can call and ask to speak with me.
I will call you then. My name is Marilyn McLaren.
Wonderful, Marilyn. I look forward to speaking with you.
Thank you, Sarah.
Of course.
Ready. Someone asked a question. I answered it in the chat, but for those who are asking if Senior Planet is offering any in-person programs, at this time we are not. However, when we do plan on reopening, we will be making that announcement on our website.
Do you plan on reopening?
When we can safely reopen with appropriate
In
protocol.
2 years or something?
You know, we don't know. We're navigating
Okay.
the pandemic and the different variants. So when we do, it will be announced. But until then, we have over 50 virtual programs that take place every week. And as my colleague Sherilyn mentioned, if you visit our website, and I'll be putting that in the chat again, you can take a look at all the offerings we have available.
Marco, there's still a few other hands up. We have a few more minutes, so.
I'm Vanessa,
Hi,
and I
Vanessa.
just wanted to give, a compliment to Senior Planet Tech Support, because it has helped. There were times that I couldn't get through, I think it was the woman who was speaking who helped me get on in the first place through Zoom, because I was having a problem. And it's just been wonderful. And I think it's great that they started having where you could sign up for a time, where you could have someone to work with you, because I did that one time, and that was really good, very personal. So I guess it was a busy, time. But thank you for, having that technology hotline and the tech classes.
Well, thank you for being a member of Senior Planet, and we hope you give us a call soon.
Yeah.
I do not see any other hands raised, so I would like to, I see one hand just went up. Danielle, I will let you take the floor.
Okay, thanks so much. I appreciate all the presentations as a staff member of Elm Court Senior Center and a newly minted senior. Woohoo! 60, going strong. Appreciate our new Senior Planet before the pandemic, and the work that you've done since the pandemic started has been phenomenal. And I just have to thank you so much. Nothing's perfect. It takes a lot to work with all that needed to happen, with all the interaction, but you guys have done a wonderful, wonderful job. And I would encourage anybody, any older adults out there, to join their local senior center. That's another avenue of connecting with LiveOn NY, with Senior Planet, and other activities within their local community, because that's the lifeline. And we're here, we're in East Elmhurst, Queens, but any senior center, the one closest to you, call 311, call Department of the Aging, so that you can access some of these services. I think that it's essential that we keep doing these types of presentations and letting people know what's out there, what's available, and let them keep reaching out. We're connected to each other. It works. It just works. So thank you very much.
Danielle, we need to hire you.
Oh, anytime. I do commercials.
Thank you, Danielle. I'm going to answer the one question that's in the chat regarding Senior Planet, and then I'll take the one last question from Oren, who has their hand raised. But first, I will answer the question about, are some of the programs available online for Senior Planet? You live in Chicago. All of our programs are available right now online. We have people from Panama in South America joining us. We have people from South Africa joining us. So all of our programs are available online at this time, and people from all around the world are joining our program. So you're more than welcome to do so. And in the follow-up email, I will be sharing not just our website, but every presenter's website tonight, who presented tonight, in an email. So thank you for your question. And then the final question I will be taking is from Oren. I will lower your hand and you have the floor.
It's not a question as much as it is a comment. There's some people here that are very frustrated about a topic that is not related to this. Oh boy, now my phone is. So I'm trying, or not related to this forum, and I just wanted to comment, this is not a town hall, and I hope you don't get discouraged from having more presentations like this, because I really appreciate it. That's all. Thank you very much.
Thank you, Oren, and really appreciate your comment. And I want to say that this webinar was put together in mind with trying to help older adults age in place with 3 specific topics. I understand when people want to speak to the council member, and we are there for them. We have put in the chat, and we've announced several times that the avenue to do that is separate outside of this particular presentation. And I want to thank everybody that joined us tonight. And thank you for your time. Thank you for your interest. Thank you to the 3 partnering organizations that did tremendous presentations for us tonight. And that's Kim Lerner of LiveOn NY, Sarah from NYSARC, and Marco and Sherlyn from OATS from AARP. You all did an amazing job. We could not have done this without you. All the webinars we've done in the past have been all on different topics, and we really hope they have helped people in, exploring the different options and resources that are out there. So thank you very much, everybody. And I want to wish everyone a good night, a safe and happy holidays up ahead. Even with the variant that's lurking around its head again, we hope that you all stay safe and happy in the coming year. Thank you so much.
Thank you, Rita.
Excellent
Thank you, everybody. Have a
Thank
great
you,
night.
everyone, for joining and having us. Have a good night.
Thank you. Good night.
Have a good night. Good night, everyone.
Thank you.
Night. Thank you.
Love you.